Hi, this is Chris Lindley and Dr. Casey Wolfington again, and we are here to talk about COVID. It's been a while since we've done a COVID update, which has been really nice, I think, mentally and psychologically for all of us. But there's some new news out there from the federal government. We're also seeing it internationally that there's a rise in cases again. And what we wanted to convey with everybody today is to be expected. COVID is here to stay. I don't believe there'll ever be a time in our life that we are on this planet without COVID-19. So as we look ahead to the fall and winter, we know we'll see an increase in cases again. I don't believe we'll ever go back to lockdowns or even mandatory masking or school closures. I think as a country, we've moved on to that because we have a lot of new tools available that we didn't have in the last 2 years. Some of those tools, before I ask you some specific mental health questions of how we deal with this, are we have great vaccination now in place. So if you have not gotten your vaccine or you're not up to date on your vaccine, following your local public health orders, please do that immediately. We have great treatments. We have antivirals. We have monoclonal antibodies. And last but not least, we know the most important thing is our health, which is not only your physical health, it's also your mental health. So tell us a little bit about, as we look ahead, knowing that we're going to have this threat looming all the time, and it's something we need to learn to live with and deal with and adapt to. How do we do that as individuals psychologically?
Well, I feel like very similar to what you just said. It's so important to have a frame. We are very comfortable with flu season because we've grown up with flu season. We know that there's a time when flus tend to increase, and we hear about them more on the news, and it's just more relevant to our life. And I think that's so important to have a frame that COVID will be here and that we can continue to live with it. We also know a lot more than we initially did with COVID-19. So we have a lot of tools. There's different levels of safety that we can engage in. That might be spending more time outside at certain times of the year with friends, taking more hand washing precautions, which are always good, right?
Always.
And having more distance if that's something that makes you feel better. But the fact is that we have more knowledge. I think the other piece is knowing that our community is a pretty active community. A lot of the things that we engage in are outside, and it really allows that level of protection against COVID-19 in and of itself. And I think that's so important. I think the other most important thing is knowing that staying inside, avoiding individuals, never great for our mental health.
Right.
So when we can connect.
Absolutely. And I think that is a lesson learned. I think as we look back at the last 2 years, we realize now today that those non-pharmaceutical interventions, so the lockdowns, the closing of school, the telling folks to not get out, interact, had a real psychological impact on all of us. And going forward, we want to make sure we stay connected with each other, but in a safe way, right? Is what you're saying?
Absolutely.
Yeah.
That's perfect.
Thanks.